So I think it's time we should get started. Thank you for joining us in this session on quantitative bias assessment. It's a novel setup we are trying to do here today, and we will appreciate your feedback. It will be a podcast-like discussion. So I will start by introducing myself and my co-chair. I'm Professor Samoli. I come from the University of Athens, and I'm a member of the HEI Research Committee. And Professor David Savitz comes from Brown University, and he's been chairing the HEI Research Committee. We are going to set the stage for quantitative bias assessment with some introduction slides, and then we'll give the floor to our podcast presentation. So with that, we all know that the basic systematic biases enter the interpretation of our epidemiological findings, and the ones that mostly may drive our conclusions from epidemiological studies on air pollution health effects are the ones that are related to residual confounding and information bias that may be defined as misclassification, in case we are studying categorical exposure, or measurement error bias in case we are talking about continuous exposure, as is the case with air pollution concentrations. Selection bias in air pollution environmental epidemiology observational studies, that is the usual study designs we apply, is less of an issue. So all these kinds of systematic biases that may enter the individual studies, of course, fit into the evidence synthesis that are trying to assess existing evidence and define causality from, or confidence in the association of the evidence until the day the review is being held. So what is quantitative bias methods? There are approaches that try to assess the magnitude of the bias and use this magnitude to correct and adjust the effect estimates that reply to the question of interest. As all statistical methods, they have certain assumptions that we need to test for their validity in case we intend to apply them. And also some of the methods require validation data sets where we believe we know what is truly going on. Recently, a lot of attention has been brought into air pollution epidemiology in developing causal inference approaches to address mainly residual confounding methods, but these have not gained great application, maybe due to computational burden in some cases or lack of expertise in other cases. So one method that is gaining wider application as time goes on is the use of directly acyclic graphs that guide the selection of necessary confounders in our epidemiological models. In case of all these methods may seem too demanding to apply, it's always the case of sensitivity analysis to be used in individual studies to try to address what will be observed as a possible effect estimate under different assumptions. And this is like an indirect way of addressing these biases impacts. Other potential ways include a review of the literature to get some information of potential magnitude of this bias and then use this in literature-based information to correct our effect estimates. HEI over the course of the years has put a lot of attention in potential biases entering science findings in order to provide exactly robust science to inform policy. So it has issued a lot of requests for applications to address mainly residual confounding and measurement error. One of the studies that has been funded and one of the group has developed a lot of causal inference methods is the Harvard team under Professor Dominici. And you can see here the report on the health effects of exposure to low levels of air pollution using the Medicaid data cohort. Here they developed a causal inference approach using generalized propensity scores that were applied under 3 different application methods, using them either to produce matching populations, using them for weighting individuals in the cohort, or using them as potential adjustment in the epidemiological model. Compared the results from these causal inference approaches, these 3 different type of application, of propensity scores with, let's say, traditional statistical approach for the analysis of cohort data, including Cox proportional hazard models and Poisson models. And the reassuring finding in all cases was the consistency of the association under the application of any of these methods. The researchers point out in the report that in case that the assumptions are valid and traditional methods may still provide robust results. And they point out to the difficulty for propagating measurement error correction methods under causal inference approaches, because till now this kind of measurement error in causal inference has been applied only in categorical exposures. So under this cap also, there has been an RFA to address measurement error impact on health effect estimates and related epidemiological findings. Here is an example of one of the studies funded by a group in Imperial by Professor Katsuyani and colleagues, that as part of their work also applied several measurement error correction methods on air pollution estimates to assess the impact of nitrogen dioxide, particles, or ozone on all-cause mortality in the London residents subsample of the UK biobank. So they applied regression calibration that is most widely applied and the CIMEX simulation extrapolation method to correct for the initially unadjusted estimates that, as you may see, there was little evidence of the association to start with, but after the application of these measurement error correction methods, the effect estimates in most cases increased by 2 to 4 times, and this is consistent with literature on measurement error, indicating that this kind of bias is expected to bias our effect estimates towards the null. So there's a long history also in air pollution, in evidence synthesis to try to address causality in epidemiology, starting from the US Surgeon General 4-level hierarchy to address smoking effects on health. The later on building of 9 causality criteria proposed by Bradford Hill. The approaches undertaken by the International Agency for Research on Cancer to try to combine information from different designs, including epidemiological, animal, and mechanistic studies to address carcinogenic effects. And of course, the US EPA integrated science assessment on the causality of the association from exposure to air pollutants that resulted in this 5-level hierarchy, trying to combine also evidence from epidemiological and toxicological studies to address causality from causal to not likely to be causal. All these frameworks try to formulate a structure to assess consistency in the findings of the association under a transparent way. So for evidence synthesis, there has been a lot of methods that have been proposed in general to address how individual study may bias, the bias observed in individual studies may pass on to evidence synthesis and affect our assessment of causality. And in general, the methods that have been proposed to assess causality in this evidence synthesis approach can be separated in 2 large classes. One is like algorithmic type of tools to be applied that are more strict formulated, and the other is like a triangulation, more like a narrative approach of combination of different findings. As part of the HI review on health effects of traffic-related air pollution, there was also a long discussion of the optimal tool to be used to assess confidence in the evidence of causal effects of traffic-related air pollution on health. And the final decision of the expert panel was to use a combinational approach, first to integrate a modified grade applied tool, great for those that are not familiar, start with some classification based on the design of the methods included in the review, and then downgrade or upgrade the confidence in the association depending on certain factors. So the HI review panel decided to modify the initial assessment of observational studies because they are the only ones that are possible to study air pollution health effects and are not necessarily of low quality, and also to modify certain upgrade or downgrading factors, but in supplement, we also applied a narrative approach that tried to assess the evidence in all related literature that was selected, including literature that was not selected to be included in the meta-analysis of the health effects, because the GRADE tool heavily relies on the use exactly of the meta-analysis to assess a potential of heterogeneity of publication bias in the results. So with this input, I would like to give the floor to my co-chair, Professor Savitz.
Thank you. Let me see if I can operate this, and then I'll be all set. Make sure I'm going the right direction here. The green one. Aha, the big one. Okay. I'm going to talk about, obviously, we all recognize that the use of evidence is every bit as important as the discovery of new findings. In fact, I could argue that the benefits that could come quickly from more optimal use of the data we have may be a more realistic short-term goal than massive expansion of the data itself. Now, the use of it, I realize there's a theme to some of the writing I've been doing over the last few years, and it's this challenge of algorithms of different sorts. And it's based on a number of concerns that we want to make the best possible use of the data, but when we try to fit it into certain frameworks, there may be constraints that impede and reduce the value of the data that are generated. And I'll give a few of the issues of using algorithms. I mean, first, it's trying to present it as though if you do the right things, if you jump through the right hoops, you will get the right answer. And the algorithm will deliver that answer. These are a few specific bullet points, but I'll talk more generally about it. And it, I think, can present this sort of illusion that it's not ultimately a judgment at the end. It leads to this kind of a claim that the answer is right because it's a good algorithm and it told me what the answer was. And it tries to do that in a way that I think is not as transparent, since I think judgment is ultimately always needed at the end. But also I think that it tries to sort of supersede subject matter expertise that always is improvisational. If you get a bunch of experts on a topic in the room, you're not going to get the best information by dictating the ways in which they are permitted to use that expertise. There does need to be a little more freedom for making optimal use of the data on a given topic. And so in considering this, I've gone through this on a number of topics. I just wrote a paper. The latest one is called, related to the Bradford Hill considerations. Hill's considerations are not causal criteria. So that's another, in the series of rants on algorithms, that's the latest contribution. But let me just illustrate it with a couple of points from standard approaches. And Evie mentioned meta-analyses and the way it was used in the traffic review. And it's become the standard way to generate pooled estimates when you have a series of studies. Now, of course, that requires that the studies present the data in a form that lends itself to meta-analysis. And as was mentioned in the traffic review, there were some that were kind of off of that menu. But it also, its particular strength is really more in the, if the random error is the major concern, it is a way to pool results, assuming the studies are similar enough to minimize random error. Excuse me. And in epidemiologic studies, that's rarely the case. You can say they're similar enough, but very often there are important differences among studies. And the danger is you eliminate the opportunity to learn from the contrast across the studies, the way the methods relate to the results. And it gives, I think, this, again, this illusion of certainty. There's a large number of studies, very precise results. It sounds like it must be right, and yet, in fact, it is laden with assumptions. Another one is risk of bias scales, which are a standard, again, an algorithm for characterizing the quality of studies, which gives a score or points for different features of the study. Now, those points and the methodologic concerns are not all equal. The measurement error is often at the top of the list, and that may be the one that you really need to dig into. You shouldn't get the same number of points for dealing with selection bias, which is often not a problem at all. And so it ends up being you classify studies, low risk of bias, high risk of bias, and of course it's risk of bias, it's not actual bias, and it doesn't address the direction or magnitude. So it's kind of it's a cookbook approach to it that I think, I'm being provocative here, I recognize we all do it, and I'll come back at the end why we do it, but it is not the most thoughtful way to consider bias in my view. Now, triangulation is really a way to use the evidence use studies in conjunction with one another. And I would include it not just the studies that are addressing the same causal relationship. There may be studies that are very important that are methodologic, of looking at the quality of exposure assessment or the other features, but it's putting the data together in a more thoughtful way, not plugging it into a model, but using it conceptually to make sense of the situation or the question. So I think the tension is that algorithmic tools, and I've listed some there, have you listed others? There's a number of agencies or entities that need to follow a protocol, define a protocol and follow it. And that's for regulatory agencies, the World Health Organization. There's this pressure to not just say, well, we had a bunch of smart people look at the data and here's what they came up with, which is what I tend to find most informative and convincing, to be honest. But they have to be in a position to defend it and explain that they were following the right procedures, the same procedures they follow with every other agent, that there's a book that describes what those procedures are in great detail, and they followed the book. And again, it's coming at it from a different point of view, and I do understand why that is part of the requirement, really, the demand. And it's a matter of trying to sort of maybe build out from that a little bit more freedom. And I think quantitative bias analysis has the potential of complementing a more algorithmic-based approach. It's trying to examine the estimates that are generated empirically and ask the question of what it might be a more informative or accurate way of characterizing the evidence. And I think I like that it's explicitly a what-if exercise. It's not saying, here is the answer. It's saying, under these assumptions, what if? What would the answer be? And I think that I'm looking forward to the discussion today because it's a chance to sort of think about it in the context of not just understanding nature, but making use of the data for regulation and decision-making, which is, I think, part of the sort of HEI framework that's so important. So with that, let me introduce the speakers. Matt Fox is professor of epidemiology and global health at Boston University School of Public Health and has really been a leader in the development of quantitative bias analysis, and especially in the application, not just the generation of knowledge. And David Miller, who is formerly a branch chief at EPA, has really been active in trying to not just do risk assessment, but improve the methods for doing so. So that's the dynamic and the interaction that we're going to have the opportunity to learn from. So Matt and David, thank you.
No. You're probably better off. All right. So welcome, everyone. We are going to try something a little different, which is we are going to replicate a podcast-style conversation. So for those of you who don't know me, my name is Joe Rogan. Sorry, that's a typo there. My name is Matt Fox. I'm from Boston University. I'm an infectious disease epidemiologist. So what am I doing here? The answer is, as David said, I do work on quantitative bias analysis, and I also host a podcast called Serious Epidemiology. Anyone here know of Serious Epidemiology? Anyone listen to Serious Epidemiology? Okay, so if you know of this podcast, this is a methods podcast that I do with Haley Bannock from the University of Buffalo, and unfortunately Haley cannot be here. She was hoping to come, but she couldn't make it. And it's unfortunate for you all because Haley is actually the brains behind the podcast. I'm just the eye candy. And well, Haley tells me I'm the eye candy for a podcast, which is really useless. But you get me instead. And I am really pleased to have a chance to talk to you about quantitative bias analysis with David Miller. So David retired in 2020 after 30 years of federal service at US EPA's Office of Pesticide Programs. He joined EPA in 1992, became a branch chief in 2006, and later led work in the branch that included epidemiology and human poisoning incident review related to registered pesticides. Since retirement, he's remained active through HESI's Environmental Epidemiology for Risk Assessment Committee, which is now focusing on quantitative bias analysis, as chair of the recently formed Quantitative Bias Analysis Special Interest Group of the International Society of Environmental Epidemiology, and a guest editor on a special issue of Quantitative Bias Analysis in Global Epidemiology. He brings a valuable mix of regulatory, scientific, and practical perspective to today's conversation. So welcome, David. So we're going to be talking about quantitative bias analysis. I just wanted to start off by getting a sense, how many of you in the room know what quantitative bias analysis is before you heard what David said? How many of you? Okay, so 3 people. Okay, good. Great to know that my life's work has been basically pointless. Got it. Okay. So we're going to talk about quantitative bias analysis, and what these are, as David said, is a set of methods in which you can quantify the impact of sources of residual systematic error. So you do your study, you've got these different sources of bias, and you want to know not just, is there a bias, but what is the likely impact in terms of, as David said, direction and magnitude. Now, we've been working on these methods for quite some time, and David's been working on them as well, and so we wanted to have a conversation to talk about those. So David, as a starting point, can you just give us your take on what quantitative bias analysis is and how, in your view, you would say it is different from what we normally do for dealing with issues of residual systematic error in epidemiologic research?
Great, thank you, Matt. I'll just point out first, it probably shouldn't need to be pointed out, but I am retired from EPA in 2022, at the end of 2022, so I am just speaking on my own here, on my own personal opinions on that. So just in terms of your question, in terms of what QBA is, I see it as a way of moving from, in general, what's been purely qualitative statements regarding bias to making explicit statements or estimates about how much bias might actually matter. Traditional approach, at least as I've seen how it's been done in the literature, is to identify possible sources of bias, discuss these qualitatively, and then in the limitation section, for example, and maybe boil it down to a risk of bias estimate, as Dr. Savitz, David Savitz had mentioned on that, high risk of bias, very high risk of bias, et cetera, on that. QBA, in my mind, quantitative bias analysis takes it a step further on that. It's asking basically if bias is really present in your study, how much change might result in your final estimates, for example, effect size estimates in epidemiology, and in what direction might those changes be, for example. It importantly doesn't eliminate judgment at all in the quantitative statement, but makes it more transparent and allows the consideration of the impact on the final estimates. I've sometimes been asked about, or been told by folks that they really don't want to kind of make any assumptions. They prefer their final risk estimate or effect size estimate to kind of stand as it is. And some of my thoughts on that would be, you're automatically making assumptions when you assume that you're 100% right in your classification, for example, of exposure. And you're assuming your final number that you're making the assumption that you're right, 100% correct in your classifications of non-exposed exposed individuals. As far as confounding, for example, you're making the assumption that there's no unmeasured confounders, or if there are and you've incorporated them, that they're distributed in certain ways among the exposed population and the unexposed population. So implicitly, I guess my thinking is, if you don't want to go ahead, you want to stick with your number and don't want to make assumptions, you really are, perhaps unbeknownst to you, making assumptions when you report your estimate on that. Just the other thing I'll mention quickly, that from a regulator's or former regulator's point of view, now retired, one of the things I particularly appreciate about quantitative bias analysis, regulators generally don't see the actual raw data. We don't get to fiddle around with the raw data. We have essentially what's put into the article, for example, on that. And the nice thing, for me at least, and probably regulators in general, is you don't need to have the raw data to do quantitative bias analysis. You can take, in general, the information that's provided in the article, the epidemiological publication, and perform it based on the data that's in there. So that's kind of, for me, a real advantage. So your question, Matt, in terms of kind of how it's different, for example, from traditional ways, most papers mention bias and deal with it to a certain extent. For me, the nice thing about QBA is that it asks us to stop merely mentioning it and start estimating what it might actually have done to your estimates. So to me, that's kind of the big difference between traditional methods and quantitative bias analysis in dealing with bias.
Yeah, there's so much that I would agree with there. I mean, we have this strange system in the published literature that we have set up where we would always insist that people quantify the amount of random error in their study. There's some kind of a confidence interval, there's some kind of a p-value, Bayes factor, whatever it is. And then when it gets to all the other sources of error in your study, we just say you can list it in the discussion section after you've probably already drawn your conclusions, as if it has nothing to do with anything that you're going to use to draw your inferences based on. I mean, basically, it's the confessing your sins approach, right? As long as I tell you that I've done it, and 3 to 7 anonymous reviewers have decided it's not so bad, which who knows how they're making that judgment, then we'll just put it into the published literature and we'll just note these limitations, as if they had no impact on your final conclusions. So to me, it's essential for being able to draw good inferences. And so I'm curious for you, what is it that actually led you to start thinking about using these methods and why they are important beyond just sort of the methodologic interest that you might have in them?
Sure, okay. Basically, I think 3 things. One was when I was at EPA in the Office of Specified Programs, I found bias was often described in the epi literature as you described, Matt, just basically often reduced broad qualitative statements on that, which was unsatisfying to me because there was no discussion of how large they might be or their impact on the final numbers on that. So just dissatisfaction with the limited attempts to quantify it on that. There was also, I found was also unsatisfying, seemed to be little thoughts about how biases that you may discuss may be added to one another or multiplied to one another. So if one was 1.5 and another was 1.5, if they're in the same direction, I mean, you might get 2 to 2 1/4, for example, depending on how they combine on that. So there wasn't any discussion about how they might combine. They also might be offsetting. You might get one bias that goes in one direction, another that goes entirely in the other direction, and you might actually be kind of accidentally maybe kind of on the button.
It does happen.
So there's almost no discussion of that, even if there was some discussion of biases on it. The other thing, I guess the second of 3, was kind of a kind of a re-acknowledgement, for example, or re-recognition about, as was mentioned earlier, about confidence intervals and versus random error. That is basically the upper bound, 95% lower bounds, and upper that everybody kind of tends to focus on. And as has been said before, and again, this was kind of re-recognized this in this, is that basically deals with only random error on that, not systematic error on that. Not in any way does it deal with systematic error on it. And when you have even moderately sized studies, and particularly with large studies, it's quite possible that the systematic error you're dealing with just dwarfs the random error that most people focus on and say, geesh, I'm pretty sure it's between this lower bound and this upper bound. So systemic error, if it's large, really kind of is problematic if that's, in my opinion, if that's what you're doing. So it gave me basically, I think, kind of a thoughts in terms of how to interpret the change basically in this between just the random, which is small, and the systematic, which could shift your estimate and change the confidence intervals by quite a bit. So that I was interested in how incorporating that would be might change your estimates or your conclusions basically on that. And the third of three, it kind of made it more concrete for me, was I'm a user of Stata, an article back in 2009 in the Stata Journal, which provided a code, basically, a Stata program, it was an early one, to do quantitative bias analysis. And going through that, basically, I kind of recognized it made things a lot more concrete and more usable. I was able to kind of see how the results change by incorporating that information. It also incorporated Monte Carlo, and we'd been using it in off-specified programs as a routine part of our assessments, Monte Carlo, for about 10 years at that point on that. So I was familiar with it, and I thought that was a very useful thing to see. So bottom line was the article showed me this was not just an abstract concern, but rather there were actually out there real practical ways to explore how systematic error could change what you think your effect estimate is and might really mean.
Yeah. By the way, I'm so impressed that your confidence in admitting that you're a Stata user. I find that I'm a SAS user, and I find the R users tend to look down on us, so we have to unite in this. So I want to emphasize a few of the points that you just made, because I think those are really important. I don't understand how we got into this very weird system where we just decided that we have these methods that we can use to quantify random error. We have these methods that we can use to quantify systematic error that we're talking about. And these methods have been around for a long time. These are not new methods, and they're not particularly difficult. But we have decided as a field that it's perfectly fine to quantify one source of error, random error, but you don't have to quantify the residual systematic error. And that just seems to be a very strange thing that's a peculiarity of our field that we have just kind of gone along with. Second thing I would just emphasize is your point that you said in response to my first question, which is, many people are uncomfortable with the idea that you have to make assumptions, which you do when you do quantitative bias analysis. But you have to make assumptions when you quantify random error. You have to make assumptions about the distributions of your variables and that you've accounted for all of the variables in your model. So there's all kinds of assumptions that you're making that you violate in every model, and you're totally comfortable with it. But then you ask people to make assumptions about systematic error, and they get very uncomfortable. And I think your response was really, really apt, which is to say, effectively, if you do not quantify the impact of whatever your residual systematic error is, measurement error, selection bias, confounding, you are effectively doing quantitative bias analysis, but making the assumption that you've perfectly measured everything, there is no residual confounding, there is no selection bias. And that is really strange. And then the last thing I would emphasize is your point about the balance between systematic and random error, because we are in a world where, many of us, not me, but many of you work with very large data sets. that means that random error is, effectively approaching zero. The dominant force of error then becomes systematic error. And if you don't quantify that, if you don't try to figure out what the impact is, you get narrower and narrower confidence intervals. You get more and more confident in the wrong answer. And that is certainly not what we want to be doing. So to me, that is sort of the reason to do it. So bringing it back to thinking about the method specifically, what are the sources of residual systematic error, the biases, that quantitative bias analysis is well positioned to address? And then are there some sources of error that you think are more amenable to these methods and some that aren't?
Yeah, sure. The big three I think are considered to be misclassification or error estimates, basically misclassification, confounding, and selection bias on that. Misclassification is like error measurement, measurement error basically on it. For misclassification and confounding, I think are often the easier entry points for folks that are new to this. They tend to be a little bit more intuitive, at least what I think of them as, and are fairly well developed on it. Selection bias can be just as important, but it's often harder, I find, conceptually in terms of understanding that and including information on that. I think the broad point about QBA is that it's a general way, as Matt has said, to examine systematic error. So rather than kind of thinking of it, well, there's misclassification bias, there's selection bias, there's confounding bias, just in general, these three things can combine. It's not one narrow method for one narrow problem. It's a way of asking about how systematic error may have shaped kind of what we think we know. And I'm kind of curious from you, Matt, basically, you teach this. What is when you do teach it to students, misclassification or error, measurement error, confounding, selection bias, how do students react to that? Are they attached to one but less so to the others, or any thoughts back on that?
I have too many thoughts to actually tell you all of them. When we talk about quantitative bias analysis, effectively what we're talking about is taking a simple set of formulas to relate the data that we observe to the data we would have observed had the bias been absent by making some assumptions about what we call the bias parameters, the things that describe the amount of bias. So for a misclassification problem, that's your sensitivity and specificity of the classification system you're using, or for a confounding problem, it might be your distribution of the confounders and the strength of its effect. And then we can really just do very simple adjustments, or we can do more complicated approaches that really account for the totality of the uncertainty in what those values actually are. So when I teach them and I think about what students resonate most to, it's mostly the issues of measurement error and residual confounding. So I am personally of the opinion that if you look at the last 20 to 30 years of methods development in the epidemiologic literature, we have this laser-like focus on confounding. And we have newer and better methods to deal with confounding. And I'm just not convinced that confounding is our biggest problem. We've got so many methods, and generally speaking, we know what most of the confounders are. We measure them. There are some cases where clearly there is a lot of residual confounding. But to me, the bigger issue is measurement error. And to the extent that we either measured our exposures or outcomes poorly, or in the case of confounding, that we measured we know what they are, we measured them, we just didn't measure them well enough, or we measured them in ways that actually it's harmful to adjust for them, and it's something that we just don't spend a lot of time thinking about. And so it's measurement error and residual confounding that I find students most relate to. Selection bias, and my sense is you all feel it's not a huge issue within the field, which I think is good news, because selection bias, in my opinion, is the one that's hardest to deal with quantitative bias analysis methods. Mathematically, it's the simplest. I mean, it's really just involves 4 numbers and some division. The hard part is Selection bias is the one source of bias where you can't go to the literature to find out how much, your, like with misclassification, how good your classification system is. You can go to the literature and say, okay, I didn't validate this, but somebody else did. What did they find for the sensitivity and specificity? Or for a confounder, I could say, okay, I didn't measure this in my population, but how was it distributed in another population that I think is similar, and how strong is the effect of that confounder on the outcome? When it comes to selection bias, you are by definition dealing with people who never made it into your study, or people who made it in your study but dropped out before the end. And so how do we get information to know how that dropout relates to the things that we would care about, the exposure and the outcome? So when it comes to selection bias, the advice I always give my students is the same advice that I was given in my 8th grade sex education class, which is just don't do it at all, just avoid it completely, because dealing with it quantitatively is incredibly difficult. So that would be my take on it. So then, to turn it back to you, so in your opinion, what is it that you think we gain from bias analysis methods that we wouldn't otherwise get from the traditional approaches that we use for thinking about bias, whether it's qualitative assessments or sensitivity analysis approaches, of which quantitative bias analysis is a form of sensitivity analysis, but it's a very specific one. So what is your view on what we gain?
Yeah, I agree. I definitely agree with you. QBA is a kind of sensitivity analysis. I think of it as being kind of deeper and more structured than people typically do, kind of more open, and importantly, kind of more debatable. I mean, it's nice, basically. I mean, you may, as one example, think your not to get too specific here, but you may think that if you classified you were 100% accurate or something like that. Somebody else says, well, maybe you weren't. Maybe you were only 90% accurate in classifying your exposed individuals as truly exposed. You can discuss that, or you can say, for example, geez, I think it made, instead of 90%, it's someplace between 85 and 95%, for example. So the nice thing about QBA and sensitivity analysis in terms of what we gain for it is it becomes kind of more open to disciplined discussions, which I think is really important. So short answer, I guess, is what we gain is quantification and transparency. So instead of saying, for example, unmeasured confounders may matter or may influence results, which it kind of tends to be more typical, you ask basically how much influence would it take to materially change your conclusions. And I think that's an important question that really should be addressed by folks considering the results of epidemiology studies on it. What it does, in my mind, is it helps separate merely possible concerns about bias from concerns that might be large enough to matter on it. And then it also, as I said before, kind of makes discussions kind of more disciplined and I think more useful on that. So vague possible concerns are turned into something that's more concrete. The concern I have with risk of bias is those simply classified concerns. We're highly concerned we're concerned with a high risk of bias or a very high risk of bias, et cetera. What it does, what QBA does is asks something that I think is much more useful and much more interesting. In other words, what might that bias do or have done to our estimate?
Yeah, and I really like the way you set that up as trying to figure out when I would the amount of bias in a study would meaningfully change my conclusions, because I think that is, we think a lot about what sources of bias there are in a study. But just knowing there is potential for a bias doesn't actually tell you very much. So those risk of bias assessment tools, I'm not disparaging those in any way. It's a good exercise to go through, to think through the potential for sources of error in your study. We absolutely want to make sure we're doing that. But knowing that there's a bias is very different from knowing what the impact is. And it's amazing to me, as somebody who's done a lot of this, how poor my intuitions are about the impact of sources of bias. I mean, so one of the things that I've become very obsessed with recently is the peer review system and how it actually works. And when I go around and I ask people, okay, so you're reviewing a study and you've identified some problem, how do you make the decision that this problem is big enough for you to say, I cannot trust the conclusions of the study, if you're not in any way quantifying the impact? And I've never had anybody come back to me with a very good answer to that question, which suggests to me it's all just intuition. It's just gut, right? It's our gut feeling. And I always go back to an example that I use in teaching. So I have a colleague who was doing her dissertation work on the relationship between smoking during pregnancy and incident breast cancer. And she was doing this because there had been a previous case control study that found a 4-fold increased risk. She wanted to replicate it. She did her study and she found nothing. And so she immediately is, if you're the first person, you get your study published just fine, but you're the second one, now you're going to be compared to that one. And so she immediately had to deal with the sources of error that she had in her study. And one of the big ones was that where did she get the information from smoking during pregnancy? She got it from a question on the birth certificate. And so whenever you tell people that, the immediate reaction is, okay, well, that's going to be terrible information, right? You tell somebody, you ask somebody, they've just given birth, you ask them, did you smoke during your pregnancy? And who's going to give you good information on that? I've never been in that situation, but I know that I would lie if I had been a smoker, because we've had decades of messaging on this, and you don't want to tell people that. And so you ask people, okay, well, how bad do you think? What's the sensitivity and specificity here? And then you sort of have to actually reason it out. Well, the specificity is actually going to be really good, right? Nobody thinks to themselves, well, I didn't smoke during my pregnancy, but this doctor will think I'm cool if I say I did. But the opposite, the sensitivity is going to be really low. Maybe it's 20% of those who actually did smoke during their pregnancy will tell you. And you think, okay, well, then I'm the reviewer. I've got to say, what do I do with that information? I'm probably going to say, reject this study because the information just isn't good. And then we take that information and we quantify it, and it turns out it has zero impact. I mean, the results move almost not at all, because specificity in that case is what actually is driving the result, not sensitivity. And the sensitivity can be terrible as long as the specificity is good. But who has that intuition? And so my suspicion is because we don't quantify, we probably throw away some good information and we accept some bad information just because we don't really know how to determine when something is good information and when something is bad information. But now we're in a situation where we don't require that of people. We don't insist that people do quantitative bias analysis the way we insist people quantify random error. So I'm curious your thoughts on why. What are the barriers to using these methods, and how do we get more people to use them?
Great. Yeah, good question on that. I think the barriers are partly technical in terms of things like training, things like software, and things probably in particular, as kind of mentioned before, specifying assumptions on that. Those can be difficult to do and take some deeper thoughts about things on that. So I say it's only partly technical. I think the other one is also cultural. I think the field is more comfortable in naming biases than quantifying them on that. The thing with quantifying biases that I think they expose assumptions that can be more demanding, but in my it's more honest basically, and you get a much better picture of what your effect estimates are or might be when you are more demanding and more honest in that. So bottom line for me is I don't think it's just a methods problem. I think it's a norms problem as well.
I absolutely would agree with you that it's a norm problem. It's a culture within the field. I think it's also an incentive problem to an extent. For the norm side of things, so we were talking about these methods, and I said you effectively you're going to make a set of assumptions, And then you're just going to apply a simple formula. It can be as simple as that. We encourage people to go further, though, because you never know what the bias parameters are. You never know what the sensitivity and specificity is, even if you did an internal validation study in your population, because even those are measured with random error and systematic error, so we can have bias there. So we tend to do Monte Carlo simulations, as you mentioned, to really quantify all of the uncertainty. The problem with that is, anytime you have to quantify a source of systematic error rather than preventing it in the first place, there's a penalty. You're always going to be less certain in your results if you have to deal with this quantitatively rather than preventing it in your study design. And that's going to lead to wider uncertainty intervals. If you are going to go and do bias analysis, you are going to have a better understanding of your data, the vulnerabilities, and a more realistic interpretation of the uncertainty. But if you're the only one doing it, and everybody else is ignoring it and is just getting their studies published because they didn't quantify it, there's a disadvantage to you, I think, to actually using these methods. So I do think it's a norm change that we have to instill within the field. And I'm going to throw you a curveball because it wasn't on there, but how do we do that? Do you have any thoughts on how where do we go to, who is best positioned to insist on these kinds of changes, I guess I would say?
I'd probably say, in terms of not so much insisting, but I would probably say certainly in schools of public health, it would be one place to start on that. Probably getting it kind of more norms as editors of journals, for example, are more likely to, as they become more aware of it, they should be the ones that are saying, well, this should be done. I think it may also be somewhat, I mean, as I said before, you don't really need to actually have the raw data to do it. So anybody, you publish your article, anybody can take it and a software program and do that kind of bias analysis. So whether you can't say, geez, it's my data, nobody can do anything with it. In terms of QBA, anybody can do it on that. So for me, I would probably want to know how it might change before I put something out, for example. And then I think one of the things so that's I think.
I think it's journal. So I agree with your point about schools of public health and statistical programs and things like that. I promise you I'm not here to sell a book, but we did write a textbook on this, and if you go to the website for the textbook, we have software that's available. You don't have to buy the book. I mean, my mother would love it if you did, but you don't have to. But you go to the website and you can download all the software. The software's there. It's not particularly complicated. Again, nothing that we do in bias analysis is rocket science. That's why I do it. But if we're going to have change, it's going to have to come from reviewers, editors of journals, and people who are funding the research, saying we want to see this, because if it doesn't come from there, it's going to be challenging for individuals on their own in all cases to do this kind of work. So we talked a little bit about where it's the kinds of biases. Are there other places where you think that it's most underused right now, particular kinds of problems, particular study designs, things like that, you think that this is a place where the field could really benefit? I'll just also agree with you. I think that in terms of the funders probably are an important one. I think as they learn more about it and become more involved in seeing how it be done and how relatively easy it is to do and how it might actually affect the results and the interpretation of the results, I think funders are probably a good source, basically, of getting this to be kind of more popular on that and more, certainly, as we said, the norm. You asked about basically how it might be underused on that.
it's probably most underused basically in exactly the settings where decisions must be made despite imperfect and uncertain evidence on that. I think environmental health is one of those fields. Regulatory review, kind of where I came from, certainly one of those as well, and evidence synthesis. I think it's probably, QBA is probably underused in evidence synthesis on that. I think, pardon me, I think people recognize basically that they can kind of understand there may be biases there, but I think people kind of have an understanding, not a correct one, that there's no way, no disciplined way of saying how much that bias might matter on that. And I think QBA is kind of underused in those situations, just a lack of recognition in many ways. I think importantly, we would say there's no discipline, people under the understanding that there isn't a disciplined way of how much it might matter, but just coming from a regulatory background, from that perspective, decisions still have to be made. And one of the things we were always drilled into was a non-decision is a decision. A decision to wait is a decision on that. So I think basically it's underused in kind of those areas, but there is it is important in those areas where there's imperfect and uncertain evidence on that. So I think this is where QBA kind of really adds value.
So I have more questions for you, but we do at some point want to see if there are any questions from folks in the audience. So if you do have a question that you want to ask, please do feel free to come on up to the mic, and we will we'll take some questions. But before I do that, I just want to, so let me ask you one more question, which is, you mentioned, regulation and agency-based decisions like EPA. How does QBA fit in with the kinds of decisions that regulators need to make?
Yeah, sure. I'll just emphasize, again, I'm fully retired from EPA at the end of 2022, so I'm just speaking on my own. But my thinking is, this is ingrained into me from 30 years at EPA on that. So my thinking is that it aligns very well. Decision makers are always asking basically what assumptions drive the result, for example. How sensitive are the conclusions that the risk assessor is making to basically some of those assumptions? How wrong might we be is a typical question. And what might it take to kind of reverse the decision, or one of the questions that decision makers make on that. So QBA does not answer this perfectly by any means. Again, it's a kind of sensitivity analysis, but it's a lot better than this generic limitations, well, it might be this or it might be that, for example. So in a sense, I think the short answer to your question is that QBA fits very nicely or very naturally with the kinds of questions that people in agencies and policy settings ask on that.
Terrific. Okay. So we do have some folks interested in asking questions. So I'll start over here, and then we'll kind of zigzag back and forth. Is that all right?
So John Sam, Colorado School of Public Health. I want to bring this back to a classic Red Book risk assessment framework. There's two questions. Does X cause Y? And by how much does X, an increase in X, increase the occurrence of Y? The first question is the one that David largely dealt with when he talked about our various holistic frameworks for evidence synthesis and integration. So let's set those aside. Your quantitative bias assessment sets with the second goal, quantifying dose response or exposure response. I would make a clear distinction between calculating an effect estimate using a causal inference model from the first goal of establishing whether X causes Y, which I think is a common source of confusion and probably one that we're propagating in our teaching. Going to the second, quantitative bias analysis could be very important, and I think then the question is, how do you do it going perhaps with individual studies where you may have access to the data to sort of the meta framework that you're more often in trying to quantify dose response. A last point, lacking from the discussion, and too often the discussion, is not measurement error, but the global uncertainties in many of the environmental exposure measurements. Those used in air pollution come, for example, from piling model on top of model, analyzing satellite data, incorporating that into a land use regression, each with sources of uncertainty that we actually don't quite know how to deal with yet. So a comment, and I know I probed through a lot of issues, but I think they're all relevant to saying how well are we doing with these two questions.
I have many thoughts. So first of all, I would say I agree with your points, although I would say I think bias analysis is actually still relevant for the first question. It's a different approach in that we have a lot more flexibility in saying what would it actually take to get us from what we observe back to the null or vice versa. I personally don't love that approach, but it does exist. You want to?
Yeah. I'll comment. Clearly, the great lesson that came out of tobacco smoking was, of course, that we could ignore bias because smoking was such a hammer that you didn't have to worry about whether you'd hit the nail or not. So that was an easy one.
And yet the formulas that are the basis of all quantitative bias analysis actually came from smoking and lung cancer, just to put it to rest. So yeah.
No, fair enough. So sometimes might be important. Then the question of whether we could collectively adjust the body of data in the forest plot to say, here's the total impact, and decide which side of the line the point estimate lies on, with and without adjustment, could be useful.
Yeah, no, I agree with all of that. And then now I have the memory of a goldfish. What was the second point you were?
The second point was estimating the magnitude of the effect with as little bias as possible, basically, which we always want to do.
Yeah, to me, there's the value. It's not as you say, we propagate a lot of not great things in our teaching. I was always taught it's in causal inference epidemiology, you're trying to estimate the magnitude of the effect, not just is there an effect. And in order to do that, it's we can't just live with the idea that there might be some bias, but as long as it's not so much that it changes our conclusions on a binary, it doesn't really matter. Now it matters a lot because you need to know within reasonable boundaries how much, what is the magnitude. For that, we've got to quantify it. And you mentioned, the issues of measurement error in which it's compounded. We can build models to deal with that. The problem is that those models are going to be so complex. They will have so much uncertainty in them that the answer we will get out is we don't know yet. And that points us to bias analysis. To me, one of the great values in bias analysis is it points you to where you need more information before you can draw the conclusions. And I think that's what you would get out of those models.
Great, thanks. And sometimes it's awfully easy to try and forgive your sins by admitting to them, isn't it?
It definitely is. So.
Hi, Wei Chu, Texas A&M. Thanks for stimulating dialogue. I wanted to ask about one of the more sociological aspects, I guess, of this. And so I'm pretty sure there's an asymmetry in how one would view bias towards the null versus bias towards a larger effect. And for the young investigators here, can you really publish a study in which you do a quantitative bias analysis that converts a null study into a positive result? For a regulator, I've worked at EPA for 14 years. I find it very challenging to convince the AA or a decision maker that, well, the quantitative bias analysis said that there's an effect from pesticide X and this cancer, and therefore we should restrict it. So versus saying, oh, well, these positive studies are actually they're biased, so they're going towards the null. So I think there's a definite asymmetry in the sort of how the results of this would be interpreted, and I thought maybe just some comments on that.
So the most common place we see people use bias analysis is in cases of non-differential misclassification, because the known, on average, expected result, we don't know how much, but we know that the direction is going to be to adjust away from the bias was towards the null, which to me is like a maddening idea that we would just use it for that. because it suggests that, we're using it in cases where there probably is some non-differential misclassification, but there may be other sources of bias that are probably bigger issues. To your bigger point, the asymmetry is 100% there. But the thing to recognize about bias analysis, it is a democratic process, which is to say, as David pointed out, you don't need the raw data to do bias analysis. Even in cases where, if there's minimal measured confounding, then we could just use the summary 2x2 table that gets published and everything, and I could do a bias analysis. So you can do yours, and then I'm the reviewer, and I could say, I don't agree with the assumptions you're putting here, and I can do my own and say to you, this doesn't make any sense. And if we disagree, that's actually really important, useful information. It says, this is the next study, in order to answer this question, the next study we need to do is the one that solves the issue of the bias parameters, not another study on the same topic. So it's democratized in that sense. If there is a lot of measured confounding, we have rough adjustments we can even do for that in cases. So it is possible. Whether or not, in your sociological point about whether or not people are going to accept it, that I think is a tougher sell. But I would remind you that any study in which you have sources of residual systematic error and you don't do the bias analysis, you are doing the bias analysis, you are assuming something absurd.
Yeah, of course.
A quick comment. It's part of what I think maybe gave it sort of a bad reputation in the nutritional epidemiology. It's notoriously difficult to measure long-term diet. So they would do the usual, food frequency or whatever, and then they would de-attenuate the estimates. So the relative risk of 1.2 suddenly is 2.7. And it's the more pessimistic they were about how terrible their instrument was, the bigger the relative risk got. So it was this perverse kind of logic where the answer, as you said, is do a better job. And I would say the same thing. I don't know if that's part of the sort of the thinking, but if you make an adjustment, it has a radical impact. You don't just sit back and say, okay, we got the right answer now, we're happy. You say, we need to go back, and if it's confounding, we need to find a setting that is not as confounded, or we need to find ways, but it's this message to future researchers to go back and solve the problem, don't just fix it with QBA.
100% agree. Yep. Over here.
I'm Haitam Narabi from Lawrence Berkeley National Lab. You have already addressed this question, but I would like to steer the pot a little bit more. So some of us,
That's what we need.
some of us can't help it, but really love to complicate our lives.
Sure.
And we go for agent-based modeling, so things we do, for instance, we try to model behavior, try to model land use, vehicle ownership, freight operations, firm synthesis, evolution. We model like ride-hailing, robotaxis, all of this in one model. And then we decide to add emission processes to then later on add like some air quality layer on top in order to look into health outcomes. And so you can see like from this perspective, this is like a highly complex model. And the way we approach it is we do a lot of sensitivity analysis. We also validate each submodule differently. And the models are like of nature different, like they're algorithmics. Some are like mathematical, like some models very clear, like multinomial logits models. And so it's a very hybrid, it's composed for different things, and their uncertainty can be varied, can accumulate, can actually cancel off. And it's tracking down the whole uncertainty and the bias through the entire pipeline is pretty challenging. But the way we think about it so far is we try to match some level of empirical data and make sure that it is the sensitivity analysis makes sense. But approaching it from a QBA perspective, it sounds like a really daunting experience. Like if you want to do like a simulation, like a Markov chain, and it would take forever to actually simulate all possibilities in this like world. So I'm wondering, like, how do you think about this? How do you feel about such like endeavor? And yeah, basically that's the question. And we already actually had a conversation before about that.
Do you have thoughts on that one?
No.
So to me, when I think about what you're describing, I generally make a distinction in my head in epidemiology between statistical analyses that are designed to answer a question in a data set, and then mathematical models that are designed to project out what's going to happen in the future, like we did with the COVID pandemic, and identify what we think is our best guess as to what's going to happen in the future with lots of uncertainty. What you're describing feels to me like it's somewhere in between, right? There is empirical data underlying your analysis, but there are a whole lot of modeled assumptions that you're building in there. And my feeling on that is, if you are truly honest and transparent about the amount of uncertainty in the parameters you're putting into that, you can model all of those if that's what you want to do. But my guess is what you will end up coming away with is a point estimate that is best guess for if we really absolutely have to make decisions, and then a really wide interval around that says we don't really know. And I think about what happened during COVID, which is we did build these models and we ignored the uncertainty. We just built the models and we said we do have to make decisions, so let's go with the point estimate. And we were very wrong in many of those models. There's, what else could we have done, right? We had to do the best we could, and in your case, it sounds like that's what you're describing. But if you're being honest about it, I'm going to guess the uncertainty is the real story more than what the point estimate is, and I think that points to we have more work to do.
We also don't claim that we are doing a point estimate. The way we see it is that the direction of the change is what matters. The magnitude of it probably is not like as important, but if there is like a change in policy, infrastructure, like technology, we make sure that that's changed, that direction makes sense, and it can validate it. But also it allows us to slice dice things as we want, like the population, the fleets, and we can isolate certain systemic feedback that you would not see in like simple models.
Yeah.
So that's the.
And so a useful exercise. I'm not saying. I'm just saying. I think my conclusion would be this is a really complex endeavor, and so we should be pretty humble in what comes out of it.
Yeah.
Thanks. Anna.
Hi, Anna Rozovsky, HEI. Matt, I took your class 2 years ago this spring on quantitative bias analysis. So, and it was a great class.
How much do I owe you?
A lot of money, a lot. So I'm curious how methods have changed over the past 10 years since, and how you've taught this topic, how your teaching has changed over the past 10 years, and also how you see the future of quantitative bias analysis, one from at the individual study level and also from the systematic review level, and this is for everyone, especially with the emergence of AI tools. And I know I'm opening up a can of worms at the 11th hour here, but I'd be curious to hear your thoughts on that topic.
Oh boy. The answer is it's changed dramatically over 10 years. We wrote a textbook that we published in 2009, and we said, and it was like this thick, and we're like, this is all we really have to say on the topic. And then we thought, well, there's like a few small, things that we didn't get quite right, so maybe we'll write a second version. And then the second version is twice as long because we realized all the things that we didn't realize when we wrote the first version. I think there's a lot better understanding of the importance of being critical of the inputs to bias analyses that we didn't truly emphasize in the beginning, that really, people are uncomfortable making assumptions. That's just human nature. But what we don't want to do is go from having people be totally uncomfortable making them to being totally confident in them. And so helping people understand how to express uncertainty in a sort of a vaguely Bayesian framework, I think, is really where things are heading. Again, I'm a goldfish, so I forget. It was like a second part of that, and I already forgot what it is.
It was a question about AI.
Oh, AI. Yeah, I assume AI is listening to us, so I love AI. It's fantastic. I actually do think AI is going to make a lot of analytic tools like this much simpler because it can be built in. It's not going to be to the case where it's going to take a while before we can trust what it's spitting out. But as I said, the methods here are actually not that complicated. So I do trust it with a little bit of oversight to both go out and find the information it would need and to run them. But we're not there yet, but I do actually think it'll get there. And hopefully that does help make it more routine.
Thanks for a great session. I'm Greg Wallenius at Boston University, and I got to say, whenever I talk to students and I'm like, "How are you doing?" They're like, "Great, Matt Fox is such a great teacher." So word gets around, Matt. So I wanted
Yeah,
to.
really. Thank you.
So I remember, I'm old enough to remember when causal inference and those methods and using DAGs for everything was moving from a niche topic that only a handful of experts could really do to something mainstream that they were teaching in all the classes, and it was sort of the default. And so I wonder if there's something to be learned about the success of that movement in comparison to, I'm old enough but even then, like measurement error correction was a well-documented technique, and the need was, and it has not had the same resounding success in moving to the mainstream. So I want, I'm not an implementation scientist or behavioral scientist, but I wonder if there's something to be learned about the success of some of the movements, there might be other examples, versus the sort of more resistance to QBA or measurement error correction specifically.
Yeah, I mean, it's clear we need a lobbying organization because big confounding has like cornered the market, and that's led to all these developments in the causal inference methods. And but I mean, I will say, like, even all of those causal inference, revolution, they emphasize the need for these kinds of methods. They would go much more broad, and I support them in that. I mean, there's lots of different things that we can do to understand the sensitivity of our data to varying assumptions. This is one of them, one that I think is pretty critical, but it's not the only one. And we should be doing lots of that. I do think there is a situation where people have limited time, money, and energy. There's like a whole checklist we could create of things that everybody should do in almost every causal analysis, but nobody's going to do them because it just takes too much time and energy and computational power. But maybe AI is actually going to help us with that. Like maybe we're going to get to the point where we can set up a list of things that we think are really kind of critical for every study to do, and it wouldn't be too much for a reviewer to demand this because it's not going to be that much work for somebody to add in. And maybe that's the future. As far as like how we brand it better, I don't know. That's not my skill set.
Thanks.
I was just going to make a quick comment on that. I think that when David was talking about sort of the opportunity to do it not by the researcher but by the user of the information, and I may have more optimism that researchers are just trying to get the paper out, and if the journal will take it, it's a success. Whereas those who are trying to make use of the data for regulation or making decisions, they need to defend it. They need to, in a way that the researcher does not necessarily. I'm doing a lot of consulting these days. In a legal setting, you don't just say the author said it, it's true, it's right. You are, as the interpreter, accountable for that. And I wonder if there may be more ways to sort of have it be demand-driven on that end. There may be more success. Oh, time. Oh, we are out of time. Okay, we don't want to be in the way of ice cream. Thank you again for great presentation. Really great show.